They say respect is earned, not given. But in some places, people confuse a title with competence, a diploma with wisdom. What you're about to hear is my story. A story about the day I proved that experience weighs more than arrogance, and that courage doesn't ask for permission to save a life. My name is Laura Brennan, and I'm a nurse. Just a nurse, they said. Until the moment when being just a nurse meant being the difference between life and death. Ma Cuneta. I grew up in Cedar Falls, a small town in Iowa, where everyone knew everyone. My mother was a teacher. My father worked at the local factory. We didn't have much, but we had enough. I remember being 7 years old when my grandmother had a stroke at our Sunday dinner. I watched a paramedic work on her with such calm determination that something shifted inside me. She didn't survive, but that paramedic stayed with us, explained everything, held my mother's hand. Right there, I decided I wanted to be that person for others. Nursing school wasn't easy. I worked 3 jobs to pay tuition: waitress in the morning, library assistant in the afternoon, gas station attendant at night. My classmates went to parties while I studied between customers, but I didn't mind. Every textbook page, every clinical hour, every patient I touched brought me closer to my purpose. I graduated top of my class, not because I was smarter, but because I was hungrier. My first job was at a rural hospital in Montana. Basic care, limited resources, but incredible mentors. Then something unexpected happened. A recruiter approached me about joining a humanitarian medical team. They needed experienced nurses willing to work in conflict zones. Without thinking twice, I said yes. My family thought I was crazy. Maybe I was. But for 3 years, I served in places most people only see on news reports. War-torn regions where medicine meant improvisation, where protocols were suggestions, and where every decision carried the weight of a life. I learned to trust my instincts, to act when others hesitated, to see what others missed. Those years forged me into something different, something stronger. When I returned to the States, I wanted stability. I applied to Memorial Grace Hospital in Boston, one of the most prestigious medical centers in the country. They hired me immediately. My resume impressed them, though I never talked much about what I'd really seen or done overseas. That was my private battle, my secret armor. Now, I want to know something from you. Where are you watching this story from? Drop a comment below with your city or country. And if this beginning has already grabbed you, if you're feeling what I felt when I lived through all of this, hit that subscribe button right now, because what comes next is going to surprise you even more. Trust me on this. Cure Memorial Grace Hospital was a different world. Marble floors, state-of-the-art technology, doctors with degrees from Ivy League schools displayed proudly on their walls. Everything gleamed with prestige and money. But beneath that polished surface, there was something rotten, a hierarchy so rigid it felt medieval. Nurses were treated as assistants, our opinions dismissed, our expertise ignored. We were expected to follow orders without question, to stay silent even when we saw problems coming. The worst offender was Dr. Marcus Hartwell, chief of cardiothoracic surgery, tall, distinguished, with silver hair and an ego the size of Massachusetts. He spoke to nurses like we were furniture that occasionally made noise. I'd heard him tell a 20-year veteran nurse to just do what you're told and stop pretending you understand medicine. I'd seen him blame nurses for his own mistakes in front of patients' families. Everyone feared him because he had power, connections, and a reputation that made him untouchable. I tried to keep my head down, do my job well, go home, repeat. But I noticed things. I noticed how Dr. Hartwell rushed through patient charts, how he dismissed concerns from the nursing staff, how he performed surgeries with overconfidence that bordered on recklessness. Other nurses had learned to stay quiet. It was safer that way, but staying quiet went against everything I'd learned in those field hospitals overseas, where communication meant survival. One day, I reviewed the chart of a patient scheduled for valve replacement surgery. Something bothered me. The patient had a documented allergy to a specific antibiotic, but the pre-surgical protocol Dr. Hartwell ordered included a medication in the same family. I brought it to his attention during morning rounds. He barely looked up from his coffee. Miss Brennan, I've performed over 2,000 cardiac surgeries. I think I know how to read a chart. I pressed on. Sir, the allergy is documented right here. This medication could cause a severe reaction. He finally looked at me, and his eyes were ice. Are you questioning my medical judgment? The room went silent. Every nurse, every resident felt the tension. I'm just trying to ensure patient safety, doctor. He smiled, but there was no warmth in it. You're a nurse. Your job is to follow orders, not to play doctor. Now, unless you went to medical school while I wasn't looking, I suggest you let the actual physicians make medical decisions. The humiliation burned. Not because I was wrong, but because I was right, and it didn't matter. He changed the medication eventually, but only after after I'd been made an example of in front of the entire team. That night, I sat in my car in the parking garage and cried, not from hurt feelings, but from frustration. I'd saved lives in impossible conditions, and here I was being treated like I didn't know basic pharmacology. Thank you for still being here with me. That means you're feeling what I felt when I lived through all this. If you haven't already, subscribe now and turn on that notification bell, because what's coming next changes everything. This story is just getting started, and you won't want to miss what happens when the tables turn. Let me tell you about the parts of my past I never put on my resume. When I joined that humanitarian medical team, I thought I was prepared. I'd worked emergency rooms, intensive care units, trauma centers, but nothing prepares you for medicine in a war zone. We operated in abandoned buildings, sometimes by flashlight. We treated gunshot wounds, shrapnel injuries, children who'd stepped on landmines. The screaming never stopped. The blood never stopped. And we never had enough of anything. Supplies, time, hope. I remember a night in a makeshift clinic on the Syrian border. We received 17 casualties from a bombing, 17 people, and we had 2 doctors, 3 nurses, and barely enough equipment for 5 patients. I had to make choices no one should make. Who gets the last unit of blood? Who gets pain medication? Who gets surgery first? There was a young man, maybe 20 years old, with severe abdominal trauma. The doctor was overwhelmed with another critical patient. I knew if I didn't act, the young man would die, so I did what needed to be done. I performed procedures I wasn't technically authorized for. I made decisions that could have ended my career, but he lived. He walked out of that clinic 3 weeks later. That happened more times than I can count. In those environments, titles meant nothing. Nurse, doctor, medic, we all did whatever was necessary. I learned to read a situation faster than any protocol could teach. I learned to see the detail everyone else missed. The slight color change that indicated internal bleeding, the subtle rhythm shift that meant cardiac trouble, the patient who looked stable but wouldn't be in 5 minutes. I learned to trust my gut because my gut had been right enough times to keep people alive. I also learned what real pressure felt like, not the pressure of a busy shift or a difficult patient. The pressure of knowing that if you fail, someone dies, and there's no backup, no team to call, no better equipped hospital to transfer to, just you, your knowledge, and your hands. That pressure either breaks you or forges you into something unbreakable. It forged me. When I came back to the United States, everything felt surreal. Hospitals with unlimited supplies, specialists for every possible condition, machines that could do things we'd only dreamed of overseas. But I also saw waste, inefficiency, and egos. So many egos. Doctors who'd never faced real scarcity or made impossible choices, yet they acted like gods. I tried to fit in, tried to follow the rules, tried to respect the hierarchy, but part of me never stopped being that field nurse who'd learned that survival requires everyone to work together, not in rigid roles, but as a unit. Now I want to hear from you. Where are you watching this from? Write it in the comments below. It's incredible to see people from so many different places following stories like this one. And if you're connecting with what I'm sharing, subscribe to the channel, because what happens next will show you exactly why all that experience mattered. The humiliation in front of the team wasn't an isolated incident. Dr. Hartwell made it a pattern. Every chance he got, he'd undermine nurses, especially me. During rounds, he'd ask my opinion just to dismiss it publicly. In meetings, he'd interrupt me mid-sentence to talk over me. He once told a patient's family, right in front of me, "Don't worry, I'll make sure the nurses don't mess anything up." The other nurses warned me to stop pushing back. That's just how he is. You can't change him. Just stay out of his way. But I'd spent years in places where staying quiet meant people died. I couldn't unlearn that. The tension built for months. Then came the case that would change everything. A high-profile patient was admitted for cardiac surgery. A prominent businessman named Charles Whitmore, 62 years old, history of arrhythmia, scheduled for a complex valve replacement. Dr. Hartwell was personally handling the case. It was all anyone talked about. The prestige, the pressure, the media attention if anything went wrong. I was assigned to the surgical team. When I reviewed Whitmore's chart, red flags jumped out immediately. His medication list included several drugs that could interact badly under anesthesia. His allergy history was extensive and complex. His previous reactions to certain medications had been severe. I documented my concerns and brought them to Dr. Hartwell during the pre-surgical briefing. He didn't even let me finish. "Miss Brennan, I've reviewed this case thoroughly. Everything is under control. Your job is to assist, not to second guess." I tried again. "Doctor, I really think we should consider alternative medications for the anesthesia protocol given his history of reactions." He slammed the chart down on the table. The sound echoed through the conference room. Everyone froze. "Let me make something very clear," he said, his voice low and dangerous. "I am the chief of surgery. I have performed thousands of successful operations. You are a nurse, just a nurse. Your role is to hand me instruments, monitor vitals, and follow my instructions. You are not qualified to make clinical decisions about anesthesia, medications, or surgical protocol. Is that understood?" The room was silent. I felt every eye on me. Part of me wanted to back down, to apologize, to make the tension go away. But another part of me, the part that had been forged in field hospitals and impossible situations, refused to be silent. "With respect, doctor, I've seen this exact combination of factors cause severe complications. I'm not questioning your expertise. I'm trying to prevent a potential crisis." His face turned red. "Get out." I blinked. "Excuse me? Get out of this meeting. You're off this surgical team. I'll request a different nurse, one who knows her place." The humiliation was total. I gathered my things and walked out, feeling the weight of everyone's stares. In the hallway, I leaned against the wall and took a deep breath. I'd been right to speak up. I knew I was right. But being right didn't matter in a system that valued hierarchy over safety. What I didn't know was that in less than 48 hours, that same system would collapse, and everyone would see exactly why my concerns mattered. Despite Dr. Hartwell's attempt to remove me, hospital policy required specific nurses for specific surgical teams based on qualifications and scheduling. The head of nursing, Barbara Chen, was a veteran who'd seen every power play in the book. She quietly reassigned me back to the surgical team for Whitmore's operation. When Dr. Hartwell saw me in the pre-op area, his jaw tightened, but he said nothing. He couldn't override hospital policy without filing formal complaints, and that would require explaining why, which would mean admitting a nurse had challenged him. His ego wouldn't allow that documentation. The morning of the surgery, tension filled the operating room like a physical presence. The surgical team moved through preparations with mechanical precision. Dr. Hartwell was in his element, confident, commanding, every inch the renowned surgeon. He joked with the anesthesiologist, Dr. Stevens, a younger doctor who clearly admired Hartwell and hung on his every word. I methodically checked equipment, medications, backup systems. My years of experience had taught me to prepare for worst-case scenarios because worst cases had a habit of happening. Charles Whitmore was wheeled in, sedated but conscious enough to speak. "You're going to take good care of me, right, Doc?" he asked, his voice slightly slurred from the pre-medication. Dr. Hartwell patted his shoulder with practiced reassurance. "Mr. Whitmore, you're in the best hands in the country. You'll wake up with a brand new heart valve and be back to your golf game in no time." Whitmore smiled, then looked at me. "And you, nurse, you look like you know what you're doing." I squeezed his hand gently. "I'll be right here the whole time, Mr. Whitmore. You're going to be fine." I hoped I was right. The anesthesia was administered. Whitmore's consciousness faded, his body relaxing into the drug-induced sleep. Dr. Stevens monitored the vitals, calling out numbers with routine confidence. Blood pressure 120/80, heart rate 72, oxygen saturation 98%, all stable. Dr. Hartwell made his first incision with steady hands. The surgery began exactly as planned. For the first hour, everything proceeded normally. The team worked in synchronized rhythm, instruments passing, instructions given and followed, the mechanical precision of a well-rehearsed orchestra. I monitored everything: the patient's color, the rhythm on the monitors, the subtle changes that most people wouldn't notice. Something nagged at me, a feeling I couldn't quite name. The vitals were stable, but something felt wrong. I'd learned to trust that feeling. Then, 30 seconds can change everything. One moment, Charles Whitmore was stable. The next, alarms screamed through the operating room. His blood pressure plummeted. His heart rhythm went chaotic. His oxygen levels dropped like a stone. The monitors flashed red warnings. Dr. Stevens' voice cracked with sudden panic. "We're losing him. Pressure dropping. 60/40. Heart rate climbing. 140. 160. What's happening?" Dr. Hartwell's hands froze mid-procedure. I saw his face change, confidence draining, replaced by something I'd never seen in him before. Fear. Pure, paralyzing fear. The operating room descended into chaos. Alarms blared from every monitor. Charles Whitmore's body began showing signs of severe distress, skin color changing, muscles twitching, vital signs spiraling out of control. Dr. Stevens frantically adjusted medication levels, his movements jerky with panic. "Dr. Hartwell, what do I do? What's causing this?" But Dr. Hartwell stood frozen, scalpel still in hand, staring at the patient like he'd never seen a human body before. His face had gone pale. His legendary confidence had evaporated. I'm not sure. This shouldn't be happening. The procedure was going perfectly. I'd seen this before, not the exact medical situation, but the phenomenon. A highly skilled professional who'd never faced true chaos, suddenly encountering something outside their experience, and completely freezing. In war zones, I'd seen doctors with decades of experience lose their ability to function when faced with mass casualties or impossible conditions. It wasn't weakness. It was the human brain, shutting down when reality exceeded preparation. But in an operating room, with a man dying on the table, there was no time for understanding or sympathy. There was only action. My training kicked in, not my nursing school training, my field hospital training. The training that came from watching people die because of hesitation. I moved to the monitors, scanning the vitals with practiced speed, blood pressure crashing, heart rhythm showing multiple abnormalities, oxygen saturation in free fall, temperature rising. I processed the symptoms in seconds. It's anaphylactic shock combined with cardiac arrhythmia, I said, my voice cutting through the chaos with absolute clarity. He's having a severe allergic reaction to something in the anesthesia cocktail, and it's triggering the arrhythmia we were worried about. Dr. Stevens looked at me like I'd spoken another language. But we used the standard protocol, nothing unusual. I grabbed the medication chart. The standard protocol includes a compound that's in the same family as one of his documented allergens. His history showed sensitivity to sulfa drugs. The antibiotic in the anesthesia mix has a sulfa component. It's causing a cascade reaction. Dr. Hartwell finally spoke, but his voice was weak, uncertain. That's not possible. I've used this protocol hundreds of times. I looked directly at him. No deference, no hierarchy, just reality. With respect, doctor, we don't have time to debate possibilities. If we don't act in the next 90 seconds, Charles Whitmore dies on this table. The moment stretched. Every person in that room knew what was happening. A nurse was taking control from the chief of surgery. It violated every rule, every protocol, every understood hierarchy. Dr. Hartwell could have reasserted authority, could have ordered me to step back, could have tried to handle it himself. But he didn't. Maybe it was fear. Maybe it was wisdom. Maybe in that moment, his ego finally cracked enough to let competence matter more than title. He stepped back. "What do you need?" he asked quietly. Those 3 words changed everything. I didn't waste time with gratitude or acknowledgement. Charles Whitmore was dying and every second mattered. "Dr. Stevens, stop all current medications immediately. Flush the lines. We need epinephrine 0.3 milligrams intramuscular now. Prepare methylprednisolone 125 milligrams IV push. Get a crash cart here immediately." My voice was steady, each word clear and deliberate. In crisis situations, uncertainty is contagious. Confidence, even if you're terrified inside, keeps people functioning. Dr. Stevens moved with renewed purpose, his hands steadying as he followed instructions. A nurse ran to get the crash cart. I turned to Dr. Hartwell. "We need to stabilize his cardiac rhythm before the anaphylaxis kills him. Can you complete the immediate closure so we can address the systemic crisis?" Dr. Hartwell's hands were shaking slightly, but he nodded. Yes, I can do that." His training took over. He worked quickly to secure the surgical site, not completing the full valve replacement, but ensuring nothing was left critically open. Meanwhile, I coordinated everything else. "Someone get me his complete medication history, every pill he's taken in the last 6 months. I need to know if there's anything else that could interact with what we're about to give him." A surgical assistant ran to pull the records. The epinephrine was administered. Whitmore's body responded slightly, blood pressure ticking up a few points, but not enough. The cardiac monitor still showed dangerous arrhythmia. I'd seen this pattern before, in a field hospital in Afghanistan. A soldier had gone into similar shock from a medication reaction. Traditional protocols hadn't worked. We'd had to try something desperate, something I'd read in a research paper, but never seen implemented. "We need adenosine," I said. 6 milligrams rapid IV push, followed immediately by a 20 milliliter saline flush. It'll briefly stop his heart, but it should reset the rhythm. Dr. Stevens' eyes went wide. That's incredibly risky. If the rhythm doesn't reset," I met his gaze. "If we don't try, he's dead anyway. His rhythm is degrading. In 30 seconds, it'll be too chaotic to shock back. We have one chance." Dr. Hartwell had finished the emergency closure. He looked at me, really looked at me, maybe for the first time since I'd started working at Memorial Grace. "Have you done this before?" I could have lied. I could have exaggerated, but honesty mattered. "Once, in a combat hospital. It worked, but every patient is different." He took a breath. "Do it." The adenosine was prepared. I held the syringe, my hand absolutely steady despite my racing heart. In that moment, I wasn't thinking about hierarchy or egos or hospital politics. I was thinking about Charles Whitmore, about his family in the waiting room, about the promise I'd made to him that he'd be fine. I pushed the medication, followed immediately by the saline flush. For 6 seconds, Charles Whitmore's heart stopped. The monitor showed a flat line. The room held its collective breath. Then, like a miracle, the rhythm returned. Normal sinus rhythm. Strong, steady, beautiful. The blood pressure began to climb. Oxygen saturation improved. The monitor's angry red warnings started turning to cautionary yellows, then to stable greens. Someone whispered, "Oh my God." Someone else said, "She did it." But I wasn't done. "He's not out of danger yet. We need to monitor for secondary reactions. Keep the epinephrine ready. Watch for any signs of breathing difficulty or pressure drop." For the next hour, hour, we monitored every tiny change, adjusting medications, supporting his system, watching the crisis slowly transform into stability. Charles Whitmore, who'd been seconds from death, was going to survive, and the immediate danger had passed, but the real work was just beginning. Charles Whitmore's body had been through massive trauma, not from the surgery, but from the allergic reaction and cardiac crisis. Every system needed careful monitoring. I coordinated with Dr. Stevens to adjust the medication protocols, eliminating anything that could trigger another reaction, using alternatives I'd learned about in continuing education courses and field experience. We administered fluids to stabilize blood pressure, medications to support heart function, and steroids to prevent delayed allergic responses. The entire time, I watched Whitmore like a hawk, looking for any subtle sign of deterioration. Dr. Hartwell stood at the edge of the operating room, silent. He'd completed what he could of the surgical repair, but the valve replacement would need to be rescheduled once Whitmore recovered from this crisis. For a surgeon who prided himself on perfect outcomes, this had to be devastating. But more than that, I could see him processing what had just happened. His certainty had failed him. His experience had been insufficient. A nurse, just a nurse as he'd called me, had saved a patient's life while he'd frozen. That reality was written all over his face. After 90 minutes of intensive post-crisis care, Whitmore's vitals had stabilized completely. Color had returned to his skin. His heart rhythm was steady. His oxygen levels were normal. Dr. Stevens looked at me with something like awe. That was incredible. I've never seen anyone work like that under pressure. I didn't respond. Compliments felt meaningless in the wake of almost losing a patient. We transferred Whitmore to intensive care, where a specialized team would monitor him around the clock. I gave detailed reports to the ICU nurses, explaining every medication given, every response observed, every potential complication to watch for. They listened with the kind of attention that told me they understood how serious this had been. As I left the ICU, I found Dr. Hartwell waiting in the hallway. He looked like he'd aged 10 years in a few hours. "Nurse Brennan," he said formally, "can we talk?" I was exhausted, emotionally and physically drained, but I nodded. "Of course, doctor." He gestured to a small consultation room nearby. We entered and he closed the door. For a long moment, he said nothing, just stood there looking at the floor. When he finally spoke, his voice was different, quieter, stripped of its usual arrogance. I froze in there. I completely froze. "In 30 years of surgery, I couldn't," he trailed off. I waited. "You saved his life," he continued. "If you hadn't been there, if you hadn't known what to do, Charles Whitmore would be dead, and it would have been my fault." I didn't know what to say. Part of me wanted to agree, to let him feel the full weight of his failure. But another part, the part that understood how pressure could break anyone, felt something closer to sympathy. "You were dealing with a situation outside your normal experience," I said carefully. "That happens." He shook his head. "No, that's not what happened. What happened is I've spent so many years being treated like a god that I started believing it. I stopped listening to people who knew things I didn't. I stopped considering that I could be wrong. And today, that almost killed a man." He looked directly at me, and I saw genuine regret in his eyes. "You tried to warn me. You told me there were risks with his medication sensitivities, and I dismissed you because you're a nurse, and I'm a doctor. And in my mind, that meant your concerns didn't matter. I was wrong. Dangerously, inexcusably wrong." Word of what happened in that operating room spread through Memorial Grace Hospital like wildfire. By the next morning, every nurse, every doctor, every resident and medical student knew the story. The details varied depending on who was telling it, some versions more dramatic than others, but the core truth remained consistent. Dr. Marcus Hartwell, the untouchable chief of cardiothoracic surgery, had frozen during a crisis, and a nurse had taken control and saved the patient's life. The reaction was divided. Some of the older physicians closed ranks, downplaying the incident, suggesting that Dr. Hartwell had simply allowed me to assist more than usual. Others, particularly younger doctors and most of the nursing staff, saw it for what it was, a fundamental shift in the hospital's power dynamics and a long overdue wake-up call about the value of nursing expertise. Charles Whitmore recovered rapidly. Within 48 hours, he was conscious, stable, and asking what had happened. The hospital administration was in crisis management mode, terrified of a lawsuit, of media attention, of anything that might damage the hospital's prestigious reputation. They sent lawyers, patient advocates, and administrators to carefully explain the situation to Whitmore and his family. But Whitmore surprised everyone. When he learned that a medication reaction had nearly killed him, and that I'd been the one to identify and treat it, he insisted on meeting me. I walked into his ICU room expecting anger or fear. Instead, I found a man who looked at me like I was a superhero. "You're the nurse who saved my life," he said, his voice still weak but clear. I smiled. "I'm one of many people who took care of you, Mr. Whitmore." He shook his head. "Don't be modest. The doctors told me everything. They said if you hadn't known what to do, I'd be dead. My family told me you actually stopped my heart and brought me back." I sat in the chair next to his bed. The treatment was risky but necessary. "I'm just glad it worked." He reached out and took my hand. "Where did you learn to do that?" "The doctor said it wasn't standard protocol." I hesitated, then decided honesty was best. "I served with a humanitarian medical team in conflict zones for 3 years. I learned to handle situations with limited resources and extreme pressure. That experience taught me to trust my instincts and to try solutions that might seem unconventional." His eyes widened. "You were a combat nurse?" I nodded. "Something like that." He squeezed my hand. "Then you've saved more lives than just mine. Thank you. Thank you for not giving up on me." That moment, sitting with a patient who'd come so close to death and seeing him alive and grateful, reminded me why I'd become a nurse in the first place. But Charles Whitmore wasn't satisfied with just thanking me. He was a prominent businessman with connections throughout Boston's elite circles. He was also on Memorial Grace Hospital's board of directors. Within a week, he'd called for a special board meeting to discuss hospital protocols regarding interprofessional respect and the utilization of nursing expertise. Dr. Hartwell faced a decision that would define the rest of his career. He could try to minimize what happened, protect his reputation, maybe even blame others for the complications, or he could do something almost unheard of in the rigid hierarchy of prestigious hospitals. He could tell the complete truth and accept responsibility. To everyone's shock, he chose the latter. The hospital administration scheduled a general assembly, something that only happened for major announcements or crises. Every staff member who could attend was there, filling the main auditorium. I sat in the back, hoping to stay invisible. Dr. Hartwell took the stage, and the room fell silent. Dr. Marcus Hartwell stood at the podium, looking smaller somehow than he'd ever appeared before. The lights of the auditorium cast shadows across his face, making him look every one of his 58 years. He cleared his throat, and when he spoke, his voice carried none of its usual commanding authority. Instead, it was humble, almost fragile. "I've asked to speak to you all today because I need to address something that happened recently, something that has forced me to examine my behavior and attitudes as a physician and as a human being. Last week, during what should have been a routine cardiac surgery, a patient nearly died. Not because of surgical error, but because of my arrogance and my refusal to listen to concerns raised by a member of my team." The room was absolutely silent. You could have heard a pin drop. Nurse Laura Brennan brought valid concerns to my attention before the surgery, concerns about medication interactions and allergy risks. I dismissed her concerns not because they lacked merit, but because she's a nurse and I'm a surgeon, and I had convinced myself that my title meant my knowledge was superior. I was wrong. Catastrophically, dangerously wrong. He paused, took a breath. "When the patient went into crisis during surgery, I froze. My mind went blank. My training, my experience, everything I pride myself on, it all disappeared under pressure I hadn't adequately prepared for. If Nurse Brennan had not been there, if she had not taken control and implemented treatment protocols I didn't even know existed, Charles Whitmore would have died on my operating table." The reaction rippled through the audience. Whispers, gasps, people looking at each other in disbelief. Dr. Hartwell continued, "I've spent 30 years in medicine believing that hierarchy exists for a reason, that doctors make decisions and nurses implement them, that respect flows from titles and credentials. But what I learned last week is that competence doesn't care about hierarchy. Experience matters more than ego. And the most dangerous thing in medicine isn't lack of knowledge. It's certainty that you already know everything." He looked out into the audience, and I realized he was looking for me. "Nurse Brennan, would you please stand?" My heart stopped. Every eye in the room turned to scan the crowd. I wanted to disappear, to sink into my chair and become invisible. But slowly, I stood. The room erupted in applause. Not polite, professional applause, but genuine, thunderous recognition. Nurses cheered. Some of the doctors stood. It went on for what felt like forever. Dr. Hartwell waited for silence, then continued. "What I didn't know about Nurse Brennan, what she never talked about, is that before coming to Memorial Grace, she served for 3 years as a nurse with humanitarian medical teams in war zones. She's treated mass casualties with minimal resources. She's made life and death decisions under conditions most of us can't imagine. She has more practical experience with emergency crisis management than I have in my entire career, and I dismissed her as just a nurse." The weight of those words hung in the air. "I'm announcing today that I'm stepping down as chief of cardiothoracic surgery." Shocked murmurs filled the room. Not as punishment, but because I need to remember what it means to be a doctor who serves patients rather than his own ego. I'll continue to practice surgery, but I'll do it with humility and with respect for every member of the medical team. Additionally, I'm working with hospital administration and Charles Whitmore, who sits on our board, to implement new protocols. Protocols that require physicians to document when they dismiss concerns raised by nurses or other staff. Protocols that create formal channels for nurses to escalate patient safety concerns without fear of retaliation. And most importantly, protocols that recognize nursing expertise as equal to physician expertise, just in different domains. The applause returned, even louder this time. Dr. Hartwell stepped away from the podium, walked down into the audience, and came directly to where I stood. He extended his hand. "Thank you for saving my patient. And thank you for teaching me what respect really means." I shook his hand, and for the first time since I'd started working at Memorial Grace Hospital, I felt like a valued member of the team, not just a nurse, not just an assistant, but a professional whose knowledge and experience mattered. After the assembly, dozens of people came to talk to me. Nurses shared their own stories of being dismissed or disrespected. Young doctors thanked me for speaking up. Even some of the old guard physicians, though they didn't say much, nodded with something that looked like grudging respect. Charles Whitmore, who'd been discharged from the hospital a few days earlier, sent me a letter. In it, he wrote about how his near-death experience had changed his perspective on life, on gratitude, on recognizing the people who truly make a difference. He established a scholarship fund for nurses pursuing advanced training in emergency medicine, naming it in honor of the nurse who'd saved his life. As for me, I continued working at Memorial Grace. The atmosphere changed gradually. Doctors started asking nurses for input during rounds. Safety concerns were discussed openly, rather than dismissed. It wasn't perfect, hierarchies that deep don't disappear overnight, but it was better. Dr. Hartwell kept his word. He practiced surgery with a new humility, acknowledging what he didn't know, asking questions, listening. We worked together on several cases after that day, and the difference was remarkable. Turns out, when ego steps aside, medical care improves dramatically. Looking back on that day, on the moment when everything changed, I realize it wasn't just about saving one man's life. It was about proving that value doesn't come from titles or degrees or hierarchy. It comes from competence, experience, and the courage to act when action is needed. I became a nurse because I wanted to help people. I've done that in small-town hospitals, in war zones, and in prestigious medical centers. And I learned that the most important medical skill isn't technical knowledge, though that matters. It's the willingness to speak up when you see something wrong, even when